So welcome everyone. This is the Planning and Health in the Time of COVID-19 webinar series or virtual forum series. This morning we will focus on transportation and public spaces. And this is put on by APA California in partnership with the Northern California chapter, and it's part of the Planners for Health initiative for our state. There we go. Here's a disclaimer that I'm not even sure what this says, but maybe don't take medical advice from us. Who knows? Anyway, my name is Beth Altshuler Muñoz, and I'm involved in the Planners for Health initiative, so I was voluntold that I was welcoming everyone today. So if you don't know, we provide a framework for collaboration tools and networking opportunities for planners and public health advocates across the state to improve health outcomes through the application of equity and healthy communities principles. And this is part of a larger Planners for Health initiative at the national APA level. And Miguel Vazquez is the leader in California, and he does an amazing job, and you'll hear from him later. So before we get into our webinar, we have some very sad news that our dear, dear friend, Chris Kaczynski, passed away this past Sunday. He was a senior advisor at the Centers for Disease Control, and he was such a huge figure and leader in the health and built environment field, worked really closely with Dick Jackson on a lot of books about this stuff. You know, he was always at public health and planning conferences, always kind of an advocate for change and bringing planning and public health together. So he will be missed. He was on the webinar about a month ago that kicked off the COVID and planning series that this is, and helped us think through what to include in it. So he tested negative for COVID, but a lot of people think it was COVID because he had all the symptoms. He was in the hospital for about a week in the ICU. So either way, he's gone, and we're very sad about it. If you did know Chris, by the way, if you go to his Facebook page, people are posting information about upcoming memorials, so we can get that information to people who want it. So today we will hear from 3 speakers and then go into a small group discussion and get a report back from all the groups. So the first presentation will be on transportation and behavior change by Lauren Highleyman. I'm sorry, Lauren, I'm not sure if I know how to pronounce your last name correctly. Slow Streets by Nicole Ferrara from the Oakland Department of Transportation, Public Spaces Around the World from Cailean at Project for Public Spaces. And I'll share a little bit more about each speaker right before they talk, but Lauren is the Assistant Director at Root Solutions. She oversees several behavior change projects across a range of issues, including transportation, paper reduction, marine debris prevention, and climate change. And she also plays a leading role in developing Root Solutions trainings and other capacity building tools, like their forthcoming book, Making Shift Happen, Designing for Successful Environmental Behavior Change. So take it away, Lauren.
All right, hi everyone. Let me just get my screen shared. All right. Sorry, just a second, I need to share this differently. There we go. Can everyone see my PowerPoint?
Yes. Yes.
Hi, everyone. Thanks so much for being here today. Really glad you guys are all here and excited to talk to you about transportation and behavior change. So first, I'm going to talk a bit about how transportation behavior is changing right now, but also how it might change in the long term and what our new normal might look like. And then also a bit about how we can better understand and respond to these short and long-term changes. And then finally, how as practitioners, we can promote positive behaviors and create the changes that we really want to see in this new world. And another key takeaway is that we are not just talking about behaviors of downstream actors or audiences like writers and households, but that this can also apply to changing the behavior of upstream audiences like employers and policymakers. So first, to talk a bit about changes that we're seeing right now. One of the biggest changes is that we're seeing transit ridership plummet across the US. And in California in particular, we see transit ridership down by more than 90% at many agencies. So at BART here in the Bay Area, we see it down by more than 90%. And with the LA Metro, their bus and rail down by 65 to 75%. But of course, these overall trends vary by mode and by population. So these declines in ridership that we're seeing are driven primarily by white and white collar workers that are now working from home. And so rail ridership in particular is way down, given that that's typically a wealthier and a wider ridership. But of course, many people are still riding transit. In particular, our 2.8 million essential workers nationwide that are still relying on transit, especially buses, to get to their jobs. And in California, that's about a third of all transit commuters that are essential workers. And so these differences also, of course, have equity implications. So our transit riders tend to be lower income, especially during these times. And our transit riders, as well as workers, are also disproportionately people of color. So normally about 40% of transit riders are white, and right now only about 22% are white. And it's also important to remember that many people with disabilities also rely on public transit, as do their caregivers. So with all of this, of course, these populations are disproportionately exposed to the risk of infection. And as we know, tragically, some transit workers have already lost their lives to the disease. And so this really underscores just how important it is to think about how we can make transit safer for our essential workers, not just right now, but also in the future. So thinking about some of the potential long-term changes, and I use the word potential just because there's so many unknowns and we don't know exactly how things will play out. But one thing that we definitely might see is long-lasting fears about the safety of public transit. So in an early March survey, which of course was a while ago at this point, about half of Americans said that riding public transit posed a high health risk due to the virus. And so while this number might have gone down at this point, it's definitely the case that these types of fears could last very long into, very long into the future. So kind of an analogous situation is that there were long-lasting fears about flying after 9/11, and we don't want to underestimate that something similar could happen with public transit after, even after we have a vaccine developed. So along with these fears, that means that we are likely to see an increase in solitary modes of travel. So of course, this could look like car travel, with increased car purchases and car use. And in fact, this is what China is seeing now. And so that may be what we're going to see a little bit farther into the future. But of course, biking and walking are also solo modes of travel. So it's likely that we might also see increases in biking, walking, bike shares. One hopeful sign is that we're seeing bike sales increase right now. And so that might result in more bike riding in the future, which is promising. And then of course, a lot of people are telecommuting, working from home right now, and that could be something that stays in the future for many people. So of course that would look like less congestion, which is great, but also lower transit revenue. Another potential change may be pent-up demand for travel. So kind of once all the shelter-in-place orders are lifted, we might see a jump in air travel for bigger vacations, but even car travel locally for visiting friends, birthdays, things like that. But then another potential positive is we might see things like the demand for open streets, which is what Nicole will be talking a bit about. Demand for things like that might be here to stay. So we might see some positive, long-lasting changes. So there are obviously so many unknowns, which as planners, you know how important it is to consider and plan for different scenarios. But one thing I really wanted to emphasize is just that it's really important not to assume that behavior will return as to business as usual. We'll very likely be seeing a new normal. So it's important to think about that in terms of what behaviors we'll see. And also not making assumptions about our audiences, barriers, and motivators. So again, just not assuming that fears about public safety on transit will go away even once we have a vaccine. And so fortunately, tools like behavioral science and audience research and human-centered design are all things that can help us with this. So how can behavioral science help? Well, before we get too much into that, I wanted to make sure that we're all kind of clear on what these phrases, behavioral science and behavioral design, mean. So behavioral science is essentially the study or the science of what really drives human behavior and why people act the way that they do. And then behavior design is about how we can apply those insights in order to change behavior, and especially in our case, how to change behavior for the better, whether that's for the environment or health or to promote equity. So I wanted to kind of demonstrate the importance of this field and of behavior design and behavioral science with an example. So not from transportation, but from public health. So many of you might remember, but in the late 90s and early 2000s, millions of dollars were spent on a mass media campaign to discourage teens from using drugs. So in addition to talking a lot about the negative impacts of using drugs, these ads also showed many teens using drugs. And so unfortunately, what this did is it actually meant that teens saw all these teens on TV using drugs. So they actually thought that using drugs was more of a norm than it really was. So this campaign actually backfired, and teens that were exposed to these ads were then actually more likely to believe that marijuana use was prevalent. Example that I shared is just a really good, although unfortunate, example about how just providing information about the problem can backfire, and how not taking into account stronger motivators such as social norms can mean that our campaigns are not effective, or even worse, can backfire. So at Root Solutions, what we do is essentially help organizations use behavioral science to avoid issues like that and make their programs and campaigns more effective. We are working with 2 transportation clients right now, but essentially we help with identifying behaviors, audiences, and then this audience research that we've been talking about that's really important for finding out what's really driving behavior. And then using interventions very strategically based on what the barriers and motivators were that were identified during the audience research. And so behavioral interventions, we've kind of grouped these into 10 categories that we call our behavioral building blocks. And I just wanted to share an example of behavior design in action. So this example aligns with our building block called ordinary, which is about social norms. So in this example, we see SF BART doing a really good job of providing the right kind of information. So they are showing the desired behavior of wearing a face covering. So they're showing that positive social proof. And then they're also demonstrating that the desired behavior is the norm. So you can see the language they use, that the vast majority of BART writers already wear a face covering. So this is kind of the opposite of the example we just learned about. So you can see that BART really learned the lessons from that example. And so this is just a really great example of using good behavioral science in your communication or education campaigns. Root Solutions can't take credit for this example, but I wanted to share it as a really good example of behavior design in action. The next kind of just big point that I wanted to share is that this time that we're in, this time of disruption, provides a really great opportunity or window of opportunity to shift these hard to change habits. I think we all know that transportation behaviors are some of the hardest to change habits that there are. So research actually shows that interventions that are implemented during periods of disruption like this are more likely to be effective. So why is that? That is because the old cues, whether they're environmental or social, may no longer exist. So that means people aren't on autopilot as much. And so your interventions, whatever they might be, stand a better chance at capturing your audience's attention and then helping them to form a new habit. So this is just another example of, this is an intervention from Portland where they're really taking advantage of this window of opportunity to try to get people to think about and plan their intentions for where they will go bike riding when shelter in place is lifted. So this example actually uses a lot of different behavioral building blocks. So they're making it really easy by giving how-to information. They also ask you a few questions and then it sends you personalized information like route information. It's also hopeful and positive. It also ties into identity with the intention setting. And then of course, it's helping to help you to start form a new habit once the stay-at-home order is lifted. So this is, again, just a really good example of how we can use behavior design, especially during this time. And so I won't go into too much detail on this, but wanted to leave everyone with some ideas and takeaway thoughts that this is a really renew our previous or prior good behaviors or habits that we had, as well as to create new good behaviors and habits. So how can we either maintain walking and biking that is now started, or to get new habits to start, like commuting to work via biking once people are going back to work. And so there's lots of ideas about how to do this, and I'm hoping these are things that we can discuss together in the breakout groups. So just wanted to say thank you, and thanks for putting up with those technical difficulties right there. And to kind of apply the hopeful building block to everyone here, we just wanted to say that we are very hopeful about the prospects for doing this, because our current crisis has really demonstrated how capable we all are of swift, drastic, and collective behavior change. And then these are just a few things that we might be able to also talk about in the discussion section in addition to the pre-prepared questions. So thinking about which behaviors are most problematic or concerning and how we could mitigate them, as well as then which positive behaviors we could promote to ensure that they can continue. So with that, I will hand it over to the next speaker.
Beth, it looks like you're talking, but I think you're on mute.
Sorry. I was just saying, Nicole, I'll hand it off to you so we can have much time as possible.
Okay. Hi, everybody. I'm going to pull up my PowerPoint presentation. My name is Nicole Ferrara, and I'm with the City of Oakland Department of Transportation, and I'm our Policy and Intergovernmental Affairs Advisor. And I've been working on the Slow Streets program, and I'm excited to share some of our takeaways with you and what the program is. So we're in the City of Oakland, we're in the Bay Area, just across the bay from San Francisco, for those of you who aren't familiar. And we have a population of about 450,000 people. And similar to probably many of your cities, we were dealing with overcrowding at our, what we call our Central Park, Lake Merritt. And you can see the picture here from the first few days of coronavirus shelter-in-place requirements. And you see lots of people still out and about, no masks at the time, which feels very weird to all of us now, I'm sure. And we're trying to determine solutions that would help really help people get out, be physically active, and get the mental health benefits of walking and biking and just being out with being out and about, while also ensuring that we're not promoting the spread of coronavirus and really helping to maintain physical distancing. One of our other challenges is, how do we do this when we know that the people working to make these interventions possible are among our most, our lowest paid workers. They have to be out there in the field implementing any major changes. So how do we maintain the health of and safety of our crews? And how do we do this quickly? So after lots of brainstorming, we determined that the best strategy to move forward would be the Slow Street strategy that I'll talk about. And what we did was we established 74 miles of citywide streets that had already been vetted by engineers and the public through our 2019 bike plan, our existing and proposed neighborhood bike routes, or bike boulevards, they're sometimes called. And we declared that those would be closed to through traffic, so only local traffic. And we put out barriers to really help calm traffic on certain streets. And that those could then become places dispersed throughout the city in many different neighborhoods of the city where people could, take to the streets. We wanted to kind of support the behaviors that were already happening. People are walking in the roads to avoid their neighbors. So people could do that more comfortably while diverting traffic and reducing the amount of traffic and alerting drivers that there would be people walking and biking on the streets. So within about 32 hours of deciding on this approach and announcing it in the public, to the public, we implemented 4 streets at 4.5 miles. So while we declared the 74 miles on day 1 as closed to through traffic, we implemented these soft closures, which I'll show some photos of. And the way that we selected these first 4 streets were based on some equity indicators, such as our what MTC, our Regional Planning and Transportation Planning Commission, calls communities of concern, where we have our highest proportions of communities of color, low-income communities, single-parent households, people with disabilities, etc. And we also looked at where all of our proposed bike routes were. So our existing bike routes often already have a lot of traffic calming in place, so we wanted to support expanding that to new neighborhoods. And we also wanted to look for opportunities with no major challenges, of course, like no alternative route for through traffic, no transit, no emergency services that require that street, like hospitals or fire departments, etc. So we developed some prototypes to help us get started, and tried to make them as simple as possible for our crews to be able to understand quickly how to implement them, and so that our engineers weren't creating a new kind of street design for every single intersection. So you could see here our prototype that we used. It explains how to implement the barriers and how to address any turn pockets that might send drivers to the barriers, and they're really pretty straightforward, and we're happy to share these around. And here's one of our crew members installing one of our first slow streets. So this is what they look like in person. They're pretty quick to implement. As I mentioned, that was one of our goals, quick and easy to implement, and not putting our crew members at risk. So we were able to do this one crew member at a time. They don't have to, we don't have to have loads of crews driving in one vehicle together implementing. So after that first phase, I just want to share some details and outcomes. In order to get this in the ground quickly, for those of you who are on the implementing side, we actually rented the traffic barriers and signage, and we really targeted our barriers to the highest traffic intersections. So we didn't put them on every single intersection along those 4.5 miles, but ones where we anticipated that we'd have the highest turn volumes. And then we marked each of the barriers with spray chalk so that if they got moved, it was easy to just put them back. And at first we had some volunteers helping with that on their own accord. We didn't ask them to go touching public things in the public realm, but some volunteers were helping with that, which was great. And now we have a more established maintenance protocol. Volunteers were also really, really supportive of helping with flyering and evaluation of the project. So they were posting flyers on the back of all the barricades and along telephone poles along the corridors, explaining what this was. Although, did get a lot of media attention in the Bay Area, people still kind of may have woken up to a new reality that they didn't know was coming. So helping to get the word out in that way. And then for evaluation, they helped take pictures along the corridors. We really wanted to understand if this was meeting our goals of social distancing and reduce traffic and just helping people feel comfortable in the streets. And first week the outcomes were really positive overall. There was a lot of compliance with social distancing. We didn't hear issues with that, experience issues with that. Certainly demand for more. Most drivers were really cognizant that there were people in the roadway. At the same time, however, there were certainly concerns about the process. This rolled out extremely quickly. We really wanted to get it out in advance of one of our first sunny, warm weekends. It was also Easter weekend. And we anticipated a lot of people might be drawn to come to the lake and parks. So it was rolled out really quickly, and we didn't have the time for high quality engagement, and especially in our communities of concern. So as we move forward, 6 days later, we expanded to an additional 4 streets and 4.5 miles on the network. And at this point, we had more time to make adjustments to the process. So we established some kind of internal protocols that were just really helpful in making sure that we were working with our emergency operations center and established a plan with them. And that includes our fire department, police department, parks and rec, our public works department, who manages our trash pickup and street sweeping, et cetera. So a number of different departments all working together on emergency operations related to COVID. So we worked to establish channels of communications through Microsoft Teams that you all might be using, and just a more standard process that has been really helpful and clarifies just how we move forward together. We also have been much more proactive in our coordination with partner agencies, the County Public Health Department, and public community-based organizations, and even across teams internally. So during the second phase, we added a round of community input and direct outreach to our community-based organizations that has continued throughout the program. And we established formal ways for input through 311 and some online surveys. And then our advocates also created these beautiful flyers that are in English, Spanish, and Chinese that help reiterate and brand our Oakland slow streets. So it was really an all hands on deck effort to really, make this program a success. And survey results came back, and they continue to come back, and the large majority of people really support the program. Over 75% of respondents are have support the Slow Streets program. However, the people who are responding are much more disproportionately white and high wealth and based in North Oakland, our wealthier part of town, than our population at large. So despite kind of efforts to attract more survey responses from communities and partnering with community-based organizations to get the word out, we're still seeing that the responses are much more skewed towards our more affluent parts of town. And that's telling us, and that combined with usage, you can see here a pretty packed street, but this isn't the typical, this isn't what we're seeing in all parts of town. So I just really want to be transparent about that. So on Friday of last week, we installed an additional 5 miles based on, again, survey results. Those miles are shown in yellow, and our candidates for future miles are shown in blue. And through this last phase, we iterated some more and built in a more regular maintenance strategy. We actually were able to bring our parking control officers back from furlough, and they've been helping to monitor all of these streets and remove or put the barriers back in place and alert our maintenance staff if any barriers are broken, so that our advocates and volunteers can focus more on evaluations and less on that type of work. And we're also working on a virtual strategy, so working with Apple Maps and Google and Waze to redirect traffic off of these streets if not needed to reach your final destination. And then thinking about tactical urbanism. So here you could see, this is actually not a slow street, but you could see some community members taking it upon themselves to establish their own slow street interventions and work to help just calm traffic in their neighborhood. So thinking about how we can support that and what that process would look like moving forward. And then in the third phase, we actually decided to add some additional streets that are off the neighborhood bike routes based on community-based organization input and input from our surveys, especially in our downtown area where most of our planned bike routes are actually cycle tracks and higher quality streets than a neighborhood bike route that's more appropriate for a residential area. Finally, in phase 4, which is coming this Friday, we have 5 more miles, and we'll be announcing those in the next 2 days, no, tomorrow. And we're really trying to think about after that point, what happens? Is this enough? Is the 20 miles of soft closures enough for this phase of coronavirus? Because what can we do to really support the parts of East Oakland that is suffering more from coronavirus, and what's the need there? We're not, again, experiencing that people are using our slow streets in East Oakland as heavily. But we are experiencing the kind of circled where East Oakland is on the map, that these are the same populations that really are suffering from COVID the worst. So maybe getting out for essential recreation isn't the highest need for this community. So we've been having a lot of conversations about that, and we're iterating over time to figure out what the best solution is to protect the health and well-being of our community members in our more disadvantaged communities. So some teasers of what we're thinking about is really emphasizing safety on our arterials in East Oakland, our high injury corridors, where we see the highest concentrations of severe and fatal crashes, especially as they relate to grocery store access or testing facilities or health centers or hospitals. So maybe shifting our focus and investment to help people get to those sites, providing other information and services for people at those sites. And then community-driven corridors. So maybe the corridors we've selected aren't the right ones for this intervention. That's something that we've heard. There are maybe perhaps better streets, and maybe they don't have to be a mile long. Maybe they're a few blocks long, etc. So these are some of the iterations we're considering to help respond to what we're hearing from our community members. And I'll end there. Looking forward to the discussion.
Thank you so much, Nicole. I live in Oakland and got to see some of the slow streets recently, so it's amazing. So Cailean, I'll pass it off to you so we can keep things moving.
Great. Let me just.
You can share your screen.
Yeah, working on it right now. Okay.
Great.
Great. Can you see everything?
Yes.
Okay, wonderful. So I'm Cailean Cook. I am a project manager at Project for Public Spaces. And today I am going to talk to you about how placemaking practitioners from around the world are really responding to COVID-19 and what we as planners can do to manage public spaces during and after as we start opening up from COVID-19. And so at Project for Public Spaces, we really envision a world where all people shape public spaces that foster civic life, belonging, and well-being in their community. And the COVID-19 crisis has really shed light on the challenges we've all faced and tried to address throughout our careers. So it's not really anything that new, but it's just put a larger highlight on this stuff. And we're now trying to think about how we can better advance engagement in the future in our new normal. So we know at Project for Public Spaces that great public spaces strengthen community. And what we do is we bring public spaces to life by planning and designing them with the people who use them every day. And so our knowledge, skills, and strategies equip people to fuel this lasting change. And together we create community-powered public spaces around the world. So I just wanted to kind of bring this back home a little bit. One of the things that, so on Monday, March 9th, as the coronavirus was spreading across the country and the world was beginning to feel like it was falling apart, I hopped on a plane at 8 a.m. in the morning to meet my counterpart for a project from the Brookings Institution in Flint for a site visit. And while in midair, Brookings issued a stop travel order and my counterpart was unable to join me. Of course, I found this out when I landed, and a couple days later, my office halted all travel and began remote working. So today, our office, well, we're very fortunate to continue our work looks very different. Our team of about 20 are working remotely, and we're not able to directly engage with the communities as we typically are lucky to do. And we're shifting the way we do our work, whether that be through finding strategies for virtual engagement, navigating how to strengthen the public realm during and beyond COVID-19, and focusing on online learning while trying to be as ethical and sensitive to the communities that we work with as possible with these online offerings. And on a personal note, I'm navigating my own mental health challenges while sheltering in place and trying at the same time to really be there for vulnerable family members and my community in Newark, New Jersey, which has been pretty hard hit by COVID-19. You don't really hear about it in the news, but it's a community that has a lot of struggles, and we're neighboring to New York City, and actually a lot of essential workers still have to go into Manhattan from Newark. So, you know, this is all things that I'm trying to think about in my daily life. So at Project for Public Spaces, we really do have this humbling experience of hearing from communities and individuals around the world as they navigate this challenging time. And with extra support from some of my amazing colleagues, especially my colleague Jackson Chabot, I gathered a few examples that I'd really like to highlight with you guys. So we all know that New York City did open streets. Given the decreased traffic and need for social spacing on sidewalk, several cities, in addition to Oakland, are considering opening up streets and pedestrian traffic. And this really is being met with mixed reception from politicians, public safety officials, and there's also concerns that these efforts are being aimed at more well-off areas and ignoring conditions in poor neighborhoods. Some of the criticisms that we've seen. Later in my presentation, I will get into some lessons learned that we can think about in our work. Another thing that we are seeing is that cities around the globe are setting up hygiene stations where people will be able to wash their hands. This is particularly important for homeless individuals who lack access to such facilities. And I have to share this story because at the start of this crisis, I was actually at the Flint Farmers Market. So it just has a really special place in my heart right now. The Flint Farmers Market has actually set up a curbside pickup, allowing its vendors to continue business and organizing for them, despite the building being closed to the public. And that's been really important because these are small businesses that exist within this public space. And farmers markets around the world are taking several actions in response to the COVID pandemic, including promoting social distancing, limiting points of contact, and increasing cleaning frequency. This is an example in Holly Springs Farmers Market in North Carolina, where they're promoting social distancing with marking of 6-foot distances and the inclusion of tables to enforce a safe distance. And I've actually seen these kind of tables in my own community when you're picking up things at different places. So I've started to see restaurants do this as well. And then we're also seeing people make use of these quasi-public spaces, such as balconies, stoops, front porches, and sidewalks. But as Linda Poon on City Lab puts it, the balconies now symbolize new kinds of freedom. So to embrace social isolation without feeling trapped, and to enjoy fresh air without worrying about breathing in the virus. She goes on to explain, though, however, that balconies are relatively scarce in many of the densest urban areas. So, for example, across the top 15 most populated metro areas, only 62% of renters have access to a balcony, patio, deck, or porch, according to the 2017 American Housing Survey. And then in San Francisco, which many of you guys are probably located, 2/3 of renters have such access, but those who spend more than half of their income on monthly rent make up just 20% of that group. And in New York City, these amenities are accessible to only 1/3 of all renters, half of whom pay at least $1,500 in monthly rent. So you can see that there's inequity there as well. And several, in some states, restaurants are starting to open up right now, but at decreased capacity. And as they are doing that, many restaurants are looking to outdoor dining, whether in a parking lot, on the sidewalk, or in public plazas, and to both meet the dining demand as well as to assist the viability of the restaurant. I fully do expect to see, similar to what Lauren was talking about, is that there'll be some pent-up demand once shelter in place is lifted in many communities. So what can we learn from some of these things that we are seeing? Well, many communities have been responding to the pandemic by looking to help our most vulnerable and disadvantaged population. And one intervention that has popped up around the world, as you saw earlier, is the installation of hand washing station. And we really do hope this is something that becomes a long-term trend, both promoting sanitation, but also providing this infrastructure to individuals who lack access to basic sanitation. However, really, we do know hand washing is not the end of equity. Every choice we make has implication in equity. Do we use public spaces to provide access to social services? For instance, do the services cater to drivers, or are they inclusive of carless individuals? And do we use public spaces for farmers markets, increasing access to healthy food? But if we do that, do our farmers markets have programs to help low-income communities take advantage of their offerings? One thing I would consider looking at if you're doing farmers market is looking at the Double Up Food Bucks program, which really helps people with EBT cards, food stamps, access more at the farmers market. And then another food for thought is, do we use public spaces for restaurant seating? And if we do, is this benefiting the wealthier patrons, or is it really for the low-wage employees? Just some things to really think about as we're opening up. In responding to COVID, there will also be competing demands for space. Fortunately, the use of space in programming does not have to be an all or nothing approach. So ahead of this webinar, Diana actually let me know that a participant wanted to hear something around the tension between expanded demand for public space among businesses like our restaurants who will probably will benefit from more outdoor dining since capacity is being reduced, but yet there's still this new behavior of curbside pickups, and there's some tensions there. And what I want to say is that it may be possible to accommodate both outdoor dining and curbside pickup. However, at some point, the growth of one will be at the expense of the other. And there needs to be this careful balancing act and an ongoing review of priorities and demands on space. So this really is a great time to consider equity in our thinking of priorities and needs there. And when balancing the competing demands and priorities for the use of public space, it's also worth considering flexibility over time, whether that's changing programming during the day to serve different needs, to make adjustments based on whether it is a weekday or a weekend or a different time of the day, or changing programming on a seasonal basis. Flexibility in the timing of programming will allow us to meet the needs of a greater population and providing a greater diversity of services and activity. So thinking about the stresses on the sidewalk and the streets, it may be worth thinking about the flexibility of those spaces and changing the use of them throughout a single day. And as someone who I really do respect, Jay Pitter said in a webinar earlier this week, the challenges presented by COVID-19 are incredibly time sensitive. And if every activity and program needs to go through standard permitting processes, by the time it's approved, the need and demand will have changed. So public spaces really need to be able to react quickly to these changing conditions. So I'm going to use an example from my husband. He's the planning director for a suburban New Jersey town. And a restaurant recently reached out to him to see if they could have temporary outdoor seating when restaurants are allowed to open up, given the anticipated decreased capacities within their facilities. And in order to allow this, my husband was explaining, the restaurant would have to obtain updated site plan approval, approval from the health department, and approval from the township council, a process that under the current policies and structure would take 6 or more months and it would really affect these businesses as they're opening up. So I of course said to my husband, you better figure out a way to make this happen, because I come from a different lens where I'm like, just figure a way to make it happen. You know, I'm not a bureaucrat. My husband is considering pitching a change in the ordinance to allow for quicker approvals, but even if he could get that support, and he is in a pretty Republican town, so we'll see how this happens. But even if he could get that support, the ordinance would take at least 2 months to pass in his town, which it really just seems like an antiquated process, and it really seems like it's time that we all look at our policies and see what changes can be made to allow for quicker decision making and responses on an everyday time frame in COVID and beyond COVID. And what we learned is that even in the time of COVID-19, the engagement process is even more important now, right? It still remains important. And without speaking to community stakeholders, we really cannot understand their true needs, and we miss out on getting community buy-in. And this is really, really important, because as we know, getting public input and responding to public needs builds greater trust. I think someone needs to go on mute. Well, hopefully someone mutes. It builds greater trust, and it increases utilization of our public spaces and programming. And equally important, the activity of public engagement also promotes health in and of itself. During emergencies such as COVID, people are really struggling for connection, but also struggling with their physical and mental well-being. And engagement builds community. It builds connection. And those connections help the most vulnerable in our society get the help and resources they need. So ensuring that there's significant engagement during this emergency will strengthen our public spaces and organizations going forward, and make your communities more prepared and resilient when the next emergency hits. And the final thing that I'll say is that the need for public space and the inequity in distribution are ever present and worsening. As Project for Public Space's CEO put it, public space must play a key role as we recover from this pandemic. We have a duty to rebuild our community to be more resilient by investing in welcoming, lively, meaningful public spaces for all. And I just hope that some of this stuff is good food for thought as we go into our discussion. Thank you.
And now we'll hand it off to Miguel Vazquez. He'll explain what we're going to do next in the small groups.
Hello, everyone. Can you hear me?
Yes.
Excellent. So we are a little bit behind schedule. So we are going to restructure just a bit our game plan. So we are going to send you all to different breakout groups so we can have hopefully a lively discussion for about 20 minutes or so, and then we'll report back. We have moderators at each one of the different breakout rooms, and they will provide you with a link to a Google Doc where you can post your questions, comments, and so on and so forth, so that the facilitator can actually have time to facilitate and not be distracted to taking notes. So with that, Diana, could you tell us who the facilitators are real quick? I don't have the list before me.
I think we can just go into small groups now.
Okay.
You'll meet your facilitators in your room.
Let's do that. Yes, and facilitators, please introduce yourselves. So let's do it.
Welcome back, everyone. I think we're getting people back in the rooms, and when everyone's back in here, we'll do a quick report back. It's so fun to see everyone coming back in.
Beth, how is your baby?
She's good.
Last time
Baby is good.
That's good.
Yes, yes. Hi, James. Yeah, it's so fun to see everyone's faces here. Oh, just our California chapter president wanted me to announce that the state APA conference is officially going virtual. So it's kind of sad, but they're excited because I think the national virtual conference went really well, and they're looking for folks to help be on the planning committee. So if you're interested in that, reach out to Julia, or maybe go on the state website and get involved. And they want to have a big focus on kind of COVID and public health and planning intersections. So it looks like most people are back. We might have lost some people. Hopefully people will join in, but Miguel, I'll hand it off to you if you want to facilitate a quick report. Oh, we only have two minutes. Okay.
Yeah, we have 2 minutes. So very quickly on my room, I think what resonated the most was the opportunity that open streets, slow streets have, but it's not an easy thing to accomplish, especially if you don't have a plan already in place, and if community engagement hasn't been done, especially in hard to reach communities. So one of the ideas I proposed was that perhaps pilot and demonstration projects in just one street could be a way to then make it bigger. So I'll stop there. Who else would like to share some of the discussion in your room?
In my group, Laura is going to actually report back. So, Laura.
Right, Laura.
Hi, everybody. My name's Laura from Philadelphia. It was really great to break out into a smaller group and have a chance to discuss some of these things a little more in depth. I think to try and summarize all our different points is we've all noticed a lot of quick action in our cities, and it's sort of wondering how these things will be maintained for whatever period of time we will still be in this period. But a lot of things we discussed in like part 2 and part 3 of the questions was using sort of like pop-ups or finding temporary ways to use parking spaces and sidewalks and things like that as opportunities to leverage these new spaces and provide what people need in this time.
Great. Thanks, Laura. Who would like to go next? I think we can do 2 more in the interest of time.
Miguel, I will say that it's 12:30 and this is supposed to end at 12:30, so this may be the opportunity to go into next steps. I'm sure others.
Excellent. Yeah. So our next steps, we will take all the feedback that we received on the Google Doc and send that to everyone who registered for. We're also going to have our next webinar in 2 weeks, which is going to focus on housing. So hopefully you can join us as well. You'll get an invitation for the registration as well. And also we are looking into hopefully establishing May as Healthy Communities Month. and we'll let you know more about it down the road. Beth, would you like to add anything? No, Diana? No?
Thank you for joining,
you for
everyone. That's
attending.
all I want to
Yeah.
say. Yeah, and if
thank
you guys
to
have
all
suggestions
panelists.
of, yes, thank you, panelists and speakers.
Thank you.
And
for
if
the-
folks have suggestions of speakers they want to hear, or if they think they have something great that they want to share and you want to be a speaker, this is all very, I don't want to say informal, but we're very open to anyone participating in a leadership role in this who wants to. So reach out to us if you are interested in participating. And here's some emails of people you can reach out to if you want to get more involved.
Well, thanks, everyone.
Have a good day, everyone.
Have a good day.
Bye. Thank you.
Bye now.
Have a good day. Bye.
Thank you. Bye-bye.
Bye-bye.
Bye.